Hi, Renee. Hi. The nurse asked me to come in and assist you with feeding, okay?
Okay.
I'm going to get the tray and we'll get started.
Okay.
Now we're getting ready to demonstrate how to feed a client that can't feed themselves. One of the things you want to make sure of course, is that you get your equipment ready prior to that. And as you can see here on the table, we have a tray with some food on it. We have a cup with water and a spoon and other things. Definitely want to make sure you have that name card. And then we have a bib or clothing protector for her, and then we have hand wipes that we're going to be using. So now I'm going to go through the steps so that you can see exactly how the skills should be performed. Okay, Renee, we're going to bring your tray around. You also want to make sure that you have a chair available because you want to make sure that you're able to sit when it's time to actually start feeding your patient. Now, one of the things you want to make sure of prior to feeding, you want to make sure that you put the patient in a 75 to 90 degree angle. One of the things that's very important is that they're in an upright position because you don't want them to aspirate while they're, being fed. So I'm going to let the head of the bed up. Renee, I'm going to let your head up, okay? Now, one of the things you want to make sure, don't worry about on test day, what's 75 or what's 90 degrees. What you want to do is just let the head of the bed up all the way into a sitting position until it stops. And then you're going to know for sure that they're sitting in a 90 degree angle, okay? Okay, we'll go no higher at this point. Are you okay? Now, the bed, of course, is in its low position. You want to bring your table around because one of the things you want to make sure of is when you're feeding a patient is that their tray is where they can see it because they want to make sure that they can see, even though they can't feed themselves, exactly what's on their tray because they have a right to let you know if it's something they like or don't like. Now, I'm going to place a bib around her, or a clothing protector, I should say. Okay, raise up there we go. And one of the things you want to make sure of, as we've stated throughout the DVD about the befores, because, again, we're order specific, so you want to make sure you do certain things prior to feeding her. One of the things it says you want to make sure of is that you pick the name card up and you actually state her name, and then you have her state her name back to you. So you are Miss Renee Smith?
Yes, ma'am.
Would you say your name for me?
Renee Smith.
All right, and she's on a regular diet. Now, one of the things you want to remember, when you're testing, you can't do part of the step and get credit. To do the entire skill is where you'll get your credit. So you can't just say her name and not have her repeat it back to you because you will not get credit for that step if you did that. You also want to make sure that you explain to them what they're going to have to eat prior to them eating, and then you want to ask them what would they like first. Renee, you got some fruit cocktail here. We have a peach and a pear.
Okay.
What would you like first?
The peach.
Okay, and then we also have some water. Okay, now prior to us doing that, of course, we're going to make sure that we wipe her hands off. Now on test day, don't hand her the hand wipe and let her wipe her hands. You want to make sure that you do that because, again, it's about you feeding your patient and you're doing what you need to do. So, I'm going to wipe her hands off. Okay, if I can get your other hand. And the reason we like to wipe their hands off prior to, even though we're feeding them, sometimes your patients, even though they can't feed themselves entirely, they may be able, like if you have some bread on the tray, they may be able to hold their food in a hand and be able to hold their bread or whatever. And that would be great. If they can do that, you want to allow them to do that because you want them to remain as independent as possible with anything that they can do. Now we're going to start feeding her. And what would you say? What did you want the peach first?
Yes.
Okay. And you want to make sure that you're sitting and that you're actually really making sure you're facing your patient so that you can actually see them chewing. That's very important, especially for our patients that may have dementia or some type of Alzheimer's. Sometimes they pocket food and they may not swallow because they may have difficulty swallowing or dysphagia. So you want to pay attention to that. This isn't the time you really want to ask your patients a lot of questions because they're trying to chew and swallow. So you just want to watch the process. You want to make sure prior to offering them any more food or any drink that everything has gone down fine. So, Renee, are you done? Can I see? Okay, great. Would you like some water? Okay. And make sure on test day that you give them the water. Don't give them the cup. You get some? Okay. Good. Did that go down okay? Okay, you ready for your next bite? Okay. And this is your pear. And again, you're just going to watch them to make sure that they're able to chew and everything's okay with their eating and swallowing process. Once they've gotten everything down, you want to make sure at this point you're going to be wiping their mouth and their hands again with hand wipes. As again, that's a two-part step, so you want to make sure that you do both steps in order to get credit. So I'm going to wipe your mouth, okay? Okay. Then we're going to take out another piece of hand wipe and wipe your hands off. And again, remember, you're doing the skill, so don't give it to them to do it. You want to make sure that you wipe their hands off on test day. Okay. And if I can get your other hand, thank you. All right. Okay. Once you've done that, you've actually completed feeding your patient, so we can now get ready to remove the tray. So I'm going to slide this out for a moment. I'm going to go ahead and remove her clothing protector. There we go. Now we're going to come back to her, but right now what we're going to do is we're going to be taking this over to the designated dirty supply stand where you're supposed to place your tray at this point. All right, so now, like I said, we're going to place this here in the designated dirty supply area. Going to go ahead and get rid of our linen. And now we're going to go back over to the bed and end our skill. All right, so now we're going to go ahead and get you situated back, comfortable in bed, okay? So I'm going to let your head down. Now, in reality, when you feed someone, you wouldn't automatically let their head all the way down because you don't want them to be at risk for aspirating. But because we're testing, it's okay. So you want to make sure the bed is in its lowest position. So we're going to go ahead and lower her head down. You always want to make sure that you leave their bed in the lowest position possible to decrease the risk of falling. Okay, and then we want to make sure that we straighten her up better and fix her a little better, okay? Okay, and now I'm going to make sure that her call signal is within reach. So, Renee, here's your call signal. If you need anything, you just give us a call, okay? And then at this point, you would say to the evaluator, I would wash my hands. This skill is now complete.